Congressman Armey said, why would we reduce ourselves to the level of other countries? Either of you want to respond to that?
Well, I want to acknowledge the United States is a great country, and we're all proud of it. And I'm also going to acknowledge I don't want the federal government buying my birthday present. Thank you, Congressman Armey.
All right.
However, it's simply not true that we excel in health care or in health. The United States ranks last among industrialized countries in terms of health status. We have higher rates of infant mortality than some countries that are quite a bit poorer than we are. We have a lower life expectancy than countries that are quite a bit poorer than we are. And we have the biggest disparities in health care and health status of any industrialized country in the world, practically. So whether or not we are the best at health care or medical care, if you measure it by how much we spend, we might be. If you measure it by the wonderful universities and medical schools where this wonderful research goes on that you're talking about, we might be. However, we don't provide access to it for everyone who needs it, and it makes us suffer as a result. We have people who are not ready to learn, they're not good workers because they're in poor health. We have kids who are dying unnecessarily, and that is what the health system in the United States has created. Now, you talk about the government being in a position to protect people's freedoms. I have never, ever, ever heard somebody say that they do not think that having access to health care and the same access as their neighbor has is somehow imposing on their freedom. We talk about cost, we talk about the role of government and how government is not an effective manager of the health care system. All of that may be true, so let's fix it, but let's not deny the fact that everybody needs access to health care.
Let me just quickly. I do feel like I have a right to respond.
No.
The fact of the matter is the federal government at the age of 65
A right to respond
reduced my
is not a right
access to health care. They forced me to have reduced access to health care and reduced liberty.
And
so you've now heard somebody say